Namaskar. I'm Dr. Vaibhavi Joshipura. I'm a periodontist, gum specialist, working with Cura Hospital, Kamanhalli branch. Today we will discuss about pregnancy and periodontal health. In simple terms, gum health. So pregnant women, various types of changes they experience during their pregnancy. Some of them experience them in their mouth. So the gums start responding in an exaggerated manner to a smallest of the irritation. So this irritation could be either because of gum infection or it could be because of injury by hard food or some toothbrush. In case of gum infection or germ buildup, there will be bleeding gums, and in case of physical injury, it is something called pregnancytumor, a tumor-like growth of the gums. Most of the time, these bleeding gums will subside once there is delivery, but in some cases, it does not subside and becomes a periodontal disease. This means pyorrhea. Generally, the pyorrhea happens in middle-aged people, but in these women, it starts early because of the pregnancy-related issues. So, the pyorrhea is characterized as bleeding gums, pus discharge from the gums, loose or shaky teeth, sensitive teeth, or bad smell from the mouth, and ultimately you lose the teeth. So, the pregnancy tumor also, it starts growing in size very fast, but as long as there is pregnancy, it keeps occurring again and again even if it is treated. So there are treatments for both these conditions, but most of the time the surgical intervention is contraindicated during pregnancy. So if the pregnancy is not high risk and if the gynecologist gives the permission, these conditions can be treated during the second trimester, that is 4th, 5th and 6th month of the pregnancy. But if not, we have to give symptomatic treatment to control the infection by prescribing antibiotics and painkillers. The problem here is most of the antibiotics and painkillers are not safe for the expectant mother and the baby. So we have very limited choice, and if the pregnant woman does not respond to the antibiotics, she'll keep suffering throughout her pregnancy with pain and swellings. All this looks very scary. So can it be treated? Can something be done to avoid all these? Yes, definitely. Maintaining gum health during pregnancy is very easy. Most of the time the gum infection is silent, so a pregnant woman may not know that she has gum infection in her mouth. So the best case scenario is to get an oral checkup or dental checkup done before conception, so that any infection in the form of either cavities in the teeth or gum infection can be treated before the pregnancy itself. But just in case, if it still happens, there is no need to panic. The faster you go and see the dentist is better. We keep doing frequent cleanings so that the need for surgical intervention is avoided and maintain the gum health. If any of these conditions do not regress, the treatment can be done even after the pregnancy. But I would again say that when you are planning your pregnancy, a very important plan should be to have an oral checkup or a dental checkup to rule out any infections in the gums. We'll discuss on some other issues in the next episode. Till then, namaskar.